So we were studying about the relation between taste, rasa, and its effect on physical body and its effect on our psychology or mind. So in the last class we were speaking that in the army, government will give a spicy, salty, oily food to the army men plus alcohol to keep their rajasicness, activeness very high. So the army people, in order to keep the rajasic quality or activeness, you should not give a food which is extremely sweet or extremely bitter or astringent. They need a pitta increasing food that is spicy and salty. So it was a question that whether the taste can influence the psychological behavior of a person. If you ask, yes, it is possible. In food, understanding the taste, administering that taste into a person, it will make big change. The only thing is, if you want to give food as medicine, it will take more time than so-called medicine, because medicine means something very strong, something in concentrated form or something in potentized form. Whereas food will be light and tasty rich. Something tasty you can take every day, something potentized or concentrated form you are not supposed to take for a long time without the advice of a doctor. Even with the advice of a doctor, you are not supposed to continue a medicine for a long time. In Siddha literature, you will find detailed that you should not continue some medicine for a long time. You should break sometimes in some medicine, especially strong medicine like bhasma, sindura, patanka, like that. You have to take some break. Otherwise, it can create some health issues. Even if it is a mild medicine, after certain time, you should take some break and continue that after the break. So if you give some food as medicine, you should understand that it is not potentized, it will take little time, but if you give medicine, it will act within a short time. Somebody who has a liver problem, liver is coming in the fire circuit, in the pitta circuit, and the liver inflammation, liver cirrhosis, we have to give some medicine or you have to give some food. If you have to give food as medicine to a liver cirrhosis person, you have to give around 100 gram of bringiraj in food style. But when you give this 100 gram of food which is rich with bringiraj, it will be very poor in taste. So nobody normally like the taste like bitter and astringent, even though it is medicinally rich. Taking for a long time, you will have some kind of aversion to the food. At that time, you dry the bringiraj, burn the bringiraj, make ash, and give that ash near about 1.5 gram. That will be equivalent to around 100 gram of raw bringiraj. When you give the medicine, it is a very small amount. People can consume that quite easily. So normally food, if you want to heal somebody with food, you will have to give a big amount. When it comes to the medicine, it is concentrated, potentized, a small amount will be more than enough. This we have to keep it in the mind. And there are some occasions you need a very urgent medicine administration. When you eat some medicine, it will go to your stomach and take digestion, and it will come to different targeted area. It may take 4, 5, 6 hours minimum, depending upon the digestion heaviness of the food you ingested to the system. So if you take some medicine, like you are going to have a brain stroke, at that time you are going to take some food or medicine, anything you take, it goes to the stomach, it digests, and when it comes to the brain, it will be late, because there is a golden time. When the golden time is over, it is going to do big harm to the patient. So we should understand that in some emergency situation, mostly food will not be enough. You need medication, something very important medication is needed. But in most of the cases, like 80% of the health issues, if you have patience, understanding with the food, you can do most of the healing. Bitter, pungent, astringent. These are the tastes, riches with air, lightness, fire content, air content. So anything fire or air content, this will increase vata. The same time, this will decrease kapha. So with understanding, if somebody has vata, you can give these tastes. But the same time, when you increase the vata, kapha also will decrease. This also you have to understand. Lightness reduces your desire to remain connected with your body, and make it more difficult for your personality to self-identify with your body, even if it want to connect to do so. Lightness is a quality of vata, and when balanced vata is there, it will make a maturity in you, and it will give strength also to your body. I will do that now. Sweet, sour, salty. Sweet, sour, sweet, sour will increase kapha, and decrease vata. Their heaviness enhances both your ability to self-identify with your body and your interest in doing so. So this is all showing that tastes can do many things on your physical level as well as in the mental level. In certain cases, we have to understand that food will act faster than the medicine also in certain conditions. Like mouth ulcer, if you take a chutney powder with manitakali or a juice with manitakali, which will act more. Hey, hey, can you just open the door for Kalyan? She can go out. Normally, a mouth ulcer, if you give medicine, it will take 6-7 days. But if you take estrogen-rich vitamin B and C rich manitakali, it will do healing faster than the medicine. In certain occasions, it will do like that. But you have to understand that in most of the big health issues, you will have to go for the potentized form of medicine. We have highly potentized medicine, we call it avartanam, repetition. We make a medicine, when it is ready, we add again, like in the oil, like Shirabala is a famous combination of repeating. We make the medicine, we get the oil, again we put all the ingredients to the oil, again we cook, then it is repeating too. Again we will put the materials, again we cook. Like you are repeating, adding the medicine and medicine and medicine. If you repeat 101 time, it will be very, very strong, potentized.